It starts with a single word: cancer. Perhaps it was said gently, but it landed like a hammer. You heard the word, and everything else just blurred. For men diagnosed with prostate cancer, this moment is disorienting. 1 second, you're living your life. The next, you're being asked to choose between removing your prostate, radiating your pelvis, or shutting down your testosterone. And chances are, no one told you what life would feel like after those choices. But I feel fine, you think. Do I really need to do anything at all? Today, we're going to walk through the treatment options for prostate cancer: surgery, radiation, and hormone therapy. We'll explain how they work, what men wish they'd known beforehand, and how today's medical landscape offers more choice and more hope than ever before. Let's start with surgery. For decades, this was performed through open surgery, with a large incision and a longer hospital stay. But now, there are better options. Robotic-assisted prostatectomy has changed the game. Instead of one large cut, robotic surgery uses small incisions, guided by high-definition cameras and precise mechanical arms. The most well-known system is the Da Vinci robot. Why does this matter? Because robotic surgery allows surgeons to spare more of the delicate nerves responsible for controlling erections and bladder function. That means faster recovery, less bleeding, and better odds of preserving quality of life. Still, it's major surgery. Let's talk about side effects. Surgery can lead to urinary incontinence. That's not just the occasional drip. Some men wear pads daily for months, or even years. And then there's erectile dysfunction. Up to 80% of men may face long-term erection issues. Even with robotic techniques, nerve damage can occur. Cricket legend Max Walker spoke openly about his incontinence after prostate surgery. Well-known broadcaster Alan Jones has shared how treatment changed his energy and personal confidence. These aren't rare stories. They're just rarely talked about. Now let's look at radiation. There are two main types: external beam radiation, usually given over several weeks, and brachytherapy, where tiny radioactive seeds are implanted directly into the prostate. Side effects still happen, and they often show up gradually, months later. Radiation could cause bowel problems, urgency, diarrhea, or bleeding. Bladder irritation is also common. Burning when urinating, increased frequency, or difficulty emptying completely. Some men experience long-term fatigue. And while the risk is low, radiation can slightly increase the chance of secondary cancers in nearby organs. The third option is hormone therapy, or ADT, which stands for androgen deprivation therapy. It's sometimes referred to as chemical castration because it drastically reduces testosterone, the hormone that fuels most prostate cancers. A DT doesn't cure prostate cancer, but it can slow it down, sometimes for years. Testosterone isn't just about sex drive. It affects mood, muscles, bones, sleep, and cognition. When it drops, men can experience hot flashes, weight gain, loss of muscle mass, memory issues, and yes, depression. Some describe it as a mental fog. A DT can also affect your mood. As testosterone levels drop, some men experience depression, emotional flatness, or even a sense of losing part of themselves. If that happens, you're not alone, and support is available. The Australian Story documentary The Enemy Within follows several men going through ADT and highlights just how real the psychological toll can be. It's a powerful watch and worth sharing with your loved ones. You can find it on the ABC website or by searching Australian Story The Enemy Within. Don't hesitate to talk to your doctor or a mental health professional. Getting support early can make all the difference. So, what's the upside? When treatments work, they can work incredibly well. Surgery or radiation can eliminate cancer in many men, especially if caught early. Hormone therapy can shrink tumors, relieve symptoms, and buy valuable time in advanced cases. But here's something that surprises a lot of men. In our previous episode, prostate cancer. Why doing nothing might be the smartest option. We explored active surveillance. This is a safe, evidence-based approach for low-risk cancers using PSA tests, MRIs, and occasional biopsies. No surgery, no radiation, no hormones. Why do nothing? Because some prostate cancers grow so slowly, they'll never cause harm in a man's lifetime. And because treatment side effects can impact quality of life for years. One of the most important studies is the Prostatectomy trial. Conducted in the UK, it followed over 1,600 men with localized prostate cancer, randomly assigned to surgery, radiation, or active monitoring. After 10 years, survival rates were nearly identical, over 98%, but side effects varied. Surgery led to more urinary leakage and erectile dysfunction. Radiation caused more bowel issues. Monitoring had fewer side effects, but some men eventually needed treatment. One participant said it best, "I didn't realize how much life would change, not because of the cancer, but because of the treatment." That's the insight many men wish they'd known earlier. The real question isn't just, what options do I have to treat the cancer? It's what kind of life do I want after my choice? Some say they'd choose differently, not because treatment failed, but because they weren't prepared for how long recovery would take, or how it would affect their relationships or identity. And yet others say, it was hard, but I'd still do it again. Especially those who had aggressive tumours caught just in time. Let's end with some hope. Prostate cancer care has transformed. Imaging is more precise. Genetic profiling helps tailor treatments. Focal therapies like HIFU and cryotherapy are emerging. And survivorship programs support men physically and emotionally. Most importantly, you're not powerless. You're not just a patient, you're a partner. And with the right information, the odds are in your favor. Here are 5 questions to ask before you commit. 1. What's the absolute benefit of this treatment? For someone with my cancer stage and risk profile, ask for numbers, not generalities. 2. What are the most common and the most serious side effects? Don't just ask if you'll be okay. Ask what recovery looks like a year or 2 from now. 3. Are there non-invasive options like active surveillance that might fit me? Sometimes the smartest first step is doing nothing safely. 4. What's the experience level of the team recommending this treatment? Ask how many procedures they've done and how often. Volume equals expertise. 5. Can I speak to men who've had this treatment? Connect with survivors. Ask what life is really like. If your doctor won't answer or rushes you, get another opinion. This is your body, your future, your choice. The good news? Prostate cancer outcomes today are better than ever. Modern screening has improved survival. More than 95% of men diagnosed with localized prostate cancer are alive 5 years later, and many live long, full lives. Treatments are better, decisions are smarter, and more men are choosing options that reflect their goals, not just their diagnosis. So if you're facing this decision, take your time. You don't have to rush. You deserve answers. And the right path is the one that aligns with your life. Let's go back to the moment of diagnosis, because for many men, it doesn't feel like a medical appointment. It feels like a moment frozen in time. You remember the doctor's face and how it felt. A wave of fear. 100 thoughts all crashing in at once. Am I going to die? Do I need treatment right now? Will I ever feel normal again? That's where stories help. Take Greg, a 62-year-old retired school teacher, diagnosed after a routine PSA test. His urologist immediately suggested surgery. But Greg paused and asked for time. He got second and third opinions. He read trial data. He watched videos like this. And eventually he chose active surveillance. 7 years later, he's still in the low-risk category and still hasn't needed treatment. Or David, who did opt for surgery. He struggled with incontinence at first, and intimacy was difficult. But with pelvic floor therapy, counseling, and time, he found a new rhythm. He said, "You'll feel broken, but you're healing." The product trial offers solid evidence, but stories give it meaning. So what should you take from all of this? It's not that one treatment is best for everyone. It's that informed choice matters more than ever. Medicine is evolving, but you still need to speak up. That means asking questions, seeking second opinions, and trusting your instincts when something doesn't sit right. Take the time to make the right choices for you. Breathe, then choose, but only when you're ready. If this video helped clarify anything for you or someone you care about, please take 1 second to like this video. Subscribe to the Second Opinion Network and share it with someone facing this decision. It might be the most important thing you do for them today. Your voice could help someone avoid unnecessary treatment or finally find the clarity they've been searching for. I'm Peter, and this is the Second Opinion Network. Until next time, stay informed, stay strong, and stay supported.